This has been such a trying time for so many people, not just worried about COVID, but also some of their other medical issues. And organizations and medical doctors have had to kind of scramble to try to figure out the best way to treat some of these people, but also to encourage people to continue with their treatment. We want to bring in Dr. Marty Belkin. He's with the Michigan Institute of Neurological Disorders. Great to have you with us, Doctor. How are you doing?
Doing well. Thanks for having me.
So with that, how are things going over at your office right now? It's looking a lot better right now as we hopefully emerge from COVID-19. But if you could take us back a year ago, were patients hesitant to come in and get treatment?
Yeah, so when the pandemic and kind of the shutdown started, we had to shut down to some degree. So we really kind of moved quickly to more of a telehealth platform. So the majority of our patients we were seeing on a virtual platform. However, some of our treatments are still essential. So patients, we still had to keep our offices open. We still had to make sure that patients could come in. Certain therapies they needed included IV therapies. Some still had to get testing, including MRIs done, and get assessments. And some people you just need to see in person, and virtual just doesn't work. And so fortunately, we were able to set up protocols where we could safely get patients into our practice and keep everything spaced and keep everyone safe. And I'm happy to say that our staff did an amazing job because we were able to keep both our staff as well as patients safe throughout that. And then as things got better, we were able to open up, and things are looking relatively normal for us now.
And so with that as well, we are hearing that maybe a silver lining that has come out of this pandemic is telehealth. More and more people and doctors are able to use it. Do you anticipate that that may be sticking around with your office?
Yes, I mean, I think there's, so we're obviously a neurology practice. And so again, many of our disorders, it's helpful to see people live, but there's many people, patients that we have that are stable on their therapies, whatever it may be, and seeing them in person isn't necessarily critical. And so, yeah, I do see telehealth staying in some way, shape, or form. Some of it's going to depend on how insurers, how they look at it going forward, and reimbursement and the real world aspect of that. But no, I think telehealth is here to stay. How it's going to look going forward, I don't know that any of us, at least in our practice, know that yet, but we anticipate it's going to be a permanent part of our practice.
Yeah, it's that little insurance piece that really kind of is going to be the key factor when it comes to telehealth. We're talking with Dr. Marty Belkin. He's with the Michigan Institute for Neurological Disorders. And doctor, if you can tell us, what are some of the disorders that you treat there?
Yeah, so we treat, neurological disorders really encompass anything that involves the brain, spinal cord, nerves, and muscles. So on an outpatient basis in our clinic, common disorders that we see, certainly we see a lot of migraine and headache disorders, dementias, particularly Alzheimer's disease, multiple sclerosis and related disorders, a lot of movement disorders, most common being like Parkinson's disease. We see various neuromuscular disorders, muscular dystrophies, nerve disorders, neuropathies, and that's just to name a few. So it's pretty wide encompassing, but so we see a lot of different disorders.
I know the Michigan Institute has been around for more than 50 years, but I wondered too, over the past year, especially when we're treating some of our dementia patients, have you seen a decline in their health at a faster rate because of the pandemic and the isolation that's been associated with this?
We have. So we see that particularly those who are in nursing homes who really, they couldn't leave, and many were confined to their rooms for months on end early on. And so we did see that had a significant impact on their well-being. You saw more of a cognitive decline. You saw more mood disorders. You even saw more, just changes in their mental status, started hallucinating, seeing things just because there was no social interaction. So yes, it really had a detrimental effect on that patient population.
Yeah, we think we had a hard time with it. Yes. And so when you're already, suffering from some of these disorders, it can really take you down that path much quicker. And so with that, because we do know there are some family members that are still uncomfortable with seeking treatment, what do you want them to know?
Well, coming into, I think most medical facilities, I think medical facilities have done a great job of making sure it's safe for patients to access care. And so I don't think there should be much anxiety about coming into the facilities. Now, obviously now with a large percentage of our population getting vaccinated, that's really changed things. So, vaccinated people really, their risk is dramatically lowered or even negligible at this point. And then, for us as healthcare providers, we are vaccinated as well. And so I think now it's a whole different ballgame than it was a year from now. And so I think really the anxieties of coming in and getting medical care really should have gone by the wayside. And I think people need to realize that life has to go on and they have to get treatment and make sure they're getting the right care and taking care of themselves.
Do you anticipate that maybe you're going to see an increase of patients needing your services as we emerge out of the pandemic?
I would think so. I mean, fortunately, we've stayed busy, and the fact that we were able to stay open where others maybe the access wasn't quite as good, we were able to stay busy and make sure patients had access when they needed us. But yes, I anticipate that in the coming months, as things really become wide open, that we are going to get busier.
We're talking with Dr. Marty Belkin with us here on the MegaCast. He's with the Michigan Institute for Neurological Disorders. And with that, Dr. too, I know that you also are a research facility. Can you tell us more about some of the research that you're conducting over there at the Institute?
Yeah, so we have a large research staff, and for years, we've concentrated primarily on research in multiple sclerosis, and we've been extremely busy in that. We've been involved in many of the clinical trials that have led to breakthrough changes in terms of treatment, bringing new therapies to market. So we're thankfully in that respect on the cutting edge, but we now have expanded the research. We're now getting into Alzheimer's disorders research. And so for so long, there's really been essentially no treatment for that patient population. And the research, thankfully, has exploded. And there's some potential therapies coming on the horizon that truly may be meaningful to patients. It maybe make much more of a difference than anything we've had, essentially true disease-modifying therapies. And so we're really looking forward to hopefully being able to offer patients truly meaningful therapies. But from a research standpoint, at least we can offer them an opportunity to get involved in clinical trials and access therapies, whether they pan out to be beneficial or not. They can access therapies that may not be available for still several years to come. So that's one area where we've expanded our research. And then we have a large center in terms of headache and facial pain. And so, again, a huge patient population who suffer daily. And so we're getting involved in clinical research in that realm as well in terms of headache and facial pain disorders.
It seems to me, too, when we talk about people who suffer from migraines, I think for those of us that know people that have gone through this, it really can sideline them, for not just a day, but several days as well because of the pain. So when you're looking at that, when should someone know, when is the time to seek out, additional medical assistance from your organization versus going to the primary care doctor or, hey, I could take a couple aspirin and this will go away?
Yeah, I mean, in terms of migraine, I mean, it's so prevalent. There's so many people that suffer from migraine specifically and even other headache disorders. And so the treatments, though, we really have some amazing treatments now. And so our expectation is that patients with migraine shouldn't have to suffer nearly as much. I can't say that we can take them away completely, but we can make them where they are much more manageable. They will no longer, hopefully, make people have to miss, numerous days of work and reduce productivity. And so, if you don't think that if you're still suffering with numerous headaches or migraines per day or per week, then you should seek out to make sure you're getting the most up-to-date care. And it's not even just medication. It's really a multidisciplinary approach. It could be supplements, it could be therapy, it could be, physical therapy, it could be sometimes certain procedures. So it's not always even taking medications. And so it's really this holistic multidisciplinary approach. And so if you just don't think that you're achieving your goals in terms of your treatment, then you should seek out care. And we have our headache and facial pain center is headed up by Dr. Lauren Amon, who's just amazing and fellowship trained in that field. And so she's helped so many people beyond what they've had before.
We're talking with Dr. Marty Belkin here on the MegaCast. He's with the Michigan Institute for Neurological Disorders. And doctor, if someone is interested in maybe trying to find out more information or to try to seek assistance with some of those clinical trials, how can they do that?
Well, so one, we have our website, which is mindonline.com. So that's one avenue. They can certainly always call our office directly, and they can be directed to the appropriate person depending on what their questions or needs are. And so that's our phone number, which is 248-553-0010. And that's gets them in contact with our main office.
So with that too, doctor, can I ask you, we are hearing so much more about clinical trials, especially with so many people with COVID-19 and trying to get participants. When you're conducting a clinical trial, what type of patient are you looking for to take part in that trial?
Well, so obviously clinical trials would be for a specific disorder, so it depends on what that diagnosis is. And then trials are designed so there's specific inclusion criteria and exclusion criteria. So there's specific guidelines on who can participate in the trial depending on age, disease state, where they are in that disorder. It could be, depending on the disorder, frequency of events or problems. And then there's exclusion criteria, certain things that if you have this or that, you unfortunately cannot participate. And so it's really strict guidelines that are set by the trial that really tell us who can be in it, who can't. But if patients are interested, you can easily be screened over the telephone, a brief screening. And if there's nothing that jumps out as being exclusionary, then we bring people in and start the process to see if they can qualify for a clinical study.
Dr. Marty Belkin with the Michigan Institute for Neurological Disorders. Doctor, anything else maybe I didn't ask that you want to add? Because I know you are doing so much work over there at the Institute.
We are. I mean, we're thankfully very busy. We have some amazing practitioners here, but it's not just about the physicians. This is really a customer service field, and we have to take good care of people. And so it's really our entire staff, from people who answer the phones to the front desk to the medical assistants to all our technicians from MRI to electrodiagnostics and many others, research staff. And so and nurses. So everyone is involved in taking their patient. I think everyone is really cares. And so I think the patient experience from the second they call to the second they, see the physician and leave is really hopefully a great experience. And it's all about servicing that patient. And I just want to kind of give a shout out to our entire staff, who I think do an amazing job.
It's been a tough year for everyone. And Can I ask too, does a patient need to be referred by their primary care doctor?
Some of that's insurance-based, so some people do need to be based on insurance if they need actual referrals, but otherwise, no. I mean, depending if the insurance doesn't require that, they can just call and make an appointment.
So if I can just quickly ask you too, I know that you were talking about some of the research. When it comes to, Alzheimer's, people hear research and they're expecting or they're hoping for help now, but some of this research takes years.
It does. And so it does. I mean, many clinical trials, go on for 2 to 3 years before they really get the data to see if it's really even effective or not. And then it has to go before the FDA, potentially get approved and really come to market. So it takes years. And that's, and then that's not to talk about the years before in early stage research that just got it to the point where it can come to the clinic. And so it takes many, many years. And when you mentioned Alzheimer's, for example, I mean, there's been unfortunately so many failed trials that just haven't panned out, but I think we're finally getting closer. And so, and I think the research is really going to, in the coming years, explode. And so, although that doesn't always help people that are suffering today, but sometimes by getting involved in trials, even if you're not helping yourself as much as you can, I mean, some people know that they're going to help other people coming down the road. And so that's obviously very important.
Yeah, I remember, when my stepfather was going through a cancer and, the treatment wasn't working any longer, he was like, sign me up for whichever clinical trials I can be of assistance because of just that. He was like, let me help someone else.
Correct. Yeah, exactly right.
So Dr. Marty Belkin with us here on the MegaCast from the Michigan Institute for Neurological Disorders. Great to have you with us. Anything maybe I didn't touch on that you want to add before we say goodbye and let you start your holiday weekend?
Yes, no, I just appreciate the opportunity. So thank you very much.
The locations, again, I know that you have one here locally, but you have what, 2 or 3 different locations throughout?
We do.
Metro
So
Detroit?
yes. So thanks for pointing that out. So we have our main facilities in Farmington Hills, Michigan, and we have a satellite clinic in Dearborn Heights. We currently have one in Madison Heights. However, that is going to be closing because we're opening a much larger facility in Roseville. That's going to really be a full service facility. So we're really excited about that. And then we're hoping to open more facilities in other areas so we can really service patients.
That's great. When do you anticipate the Roseville facility to be open?
It is opening the first week of August.
Wow. So you're doing that in the middle of a pandemic.
Yep. I got that going. So all good things.
Well, that is great to hear. We so appreciate your time today.
Oh, thanks for having me.